January, did you know this, is Thyroid Disease Awareness Month. It seems every month has something, but you know, this really has a cause to get people out there to know if they have it or not, because apparently 25 million Americans have a thyroid condition, but just haven't been diagnosed yet.
Yeah, and a lot of people don't even know that they're in that group of 25 million. Dr. Val Jones is going to help us learn a little bit about this important but forgotten or even unknown information. All right, let's start at the very beginning. Thyroid. We've heard of it. We don't know where it is or what it does, so fill us in on that.
That's right. Well, it's certainly an underappreciated part of the human body. It's a gland that's in your neck, and it's responsible for your metabolism. So everything from your body temperature to your heart rate, your blood pressure, and also your weight. So it controls a lot of things. It makes a hormone. Sometimes it makes too much of it, and sometimes it doesn't make enough, and that causes all these different symptoms.
I think that's the one thing I knew was that the tie-in with weight gain or whatever, not being able to get to optimum weight, that there was that connection.
Right. Not everyone who gains weight has a thyroid problem, of course, but we are all tempted to check that right away.
We like to blame it on it, though, right?
I sure do.
It sounds good. Nobody's going to question me if it's my thyroid. I can't help it.
I know. But some of the other symptoms are a little less obvious. You wouldn't think that, for example, carpal tunnel syndrome can mean that you have low thyroid. Isn't that bizarre?
It is.
It's because when you have low thyroid, you actually tend to retain water, and your wrist is very sensitive to swelling, and so when you're retaining water, the little nerve that goes through your carpal tunnel in your wrist can be squeezed, and then you get numb hands, numbness and tingling. So
what are the issues? Is it that you might have a thyroid gland that's not functioning as it should? Is that there might be some issue within the gland, cancer or some other thing? I mean, what are you trying to get people to think about and be aware of during what we say it is?
Thyroid Disease Awareness Month. Be aware that if you have unusual symptoms like perhaps depression, weight gain, constipation, dry skin, you should tell your doctor about that, because it might actually be related to your thyroid.
It seems so many times, though, that people, it's kind of like the last thing that maybe doctors check, or, you know, you check off so many other things down the list and, oh, it's my thyroid. Why didn't I think of that? Why? I hear that so many times with friends. Why is it that way?
Because weight gain and depression happen normally that are apart from the thyroid. So people sort of brush off these symptoms. They just think, oh, it's life, you know, and they don't realize there's a medical cause that's pretty easy to treat. So that's the good news.
What other things are connected to a thyroid that is not functioning properly?
Well, if the thyroid is making too much thyroid hormone, you get the exact opposite of a decreased metabolism. You get a racing metabolism, and I bet you can guess how that would feel. You get anxious, you get sweaty, your heart is racing, sometimes you get palpitations, irregular heartbeats. That can be very life-threatening, actually. So if you're, you know, unusually anxious and sweaty and you feel hot all the time, that's another symptom, a constellation of symptoms that might mean there's something wrong with your thyroid, so you should get a blood test.
Is there a way to do some sort of self-exam at home to see, you know, we're not doctors, we like to be, we all go on WebMD and try to self-diagnose ourselves.
Sure.
But is there a way to just, you know, right in front of a mirror, or even say, let me see right now? If so, could you show us?
I mean, well, yes. I mean, just like breast self-exams, it's possible to find a lump that is breast cancer, but it's not terribly likely. Most times breast cancer is found on a mammogram. Sometimes people can find a thyroid lump by checking their neck, but most of us, about 60% of people, end up getting just a cyst in their thyroid normally, just as many breasts have cystic tissue too, but only 5% of those lumps actually might be cancer. However, the test is free. You can do it yourself, and it's very easy. You just put your fingers on either side of your Adam's apple, just below it, and you check to see if there's any kind of lump or bump. And you swallow, and if that bump goes up and down when you swallow, it's in your thyroid gland. Now, it's a little tricky to do. You can see why only 8% of people find a lump when they have one.
Right.
But hey, you know, it's free. It doesn't hurt.
It's not the kind of lump that's, you know, driven home to check.
No.
Especially in women, you know, we think about breast cancer, we think about those kind of things, but I mean, it's staggering to see the numbers of how many people are suffering from it, and then probably suffering on top of that, not thinking that they're having this problem.
That's right. I mean, it's just, again, it's the strangeness of the symptoms that make people, they don't think there's a medical reason for it.
It's all over the map.
It's all over the map.
All right, so you say that thyroid cancer is rare. For folks who have it, how treatable is it?
Well, the good news about thyroid cancer is that it's really rather treatable. The 10-year survival rate is 90%. What that means is people tend not to die from thyroid cancer, but it's important to catch it early. There are only 37,000 Americans per year that get thyroid cancer, so it is indeed quite rare, thankfully. But if you find a lump, if you find a hard lump in your neck, if you have a change in your voice, maybe hoarseness, not from your cold, but that continues on for months at a time, for example, those might be signs that there's some cancer there. So
how would you treat it typically? What options do you look at or consider?
Well, that's complicated. It depends on, there are like 5 or 6 subtypes of thyroid cancer.
Really?
But generally, it's radiation through radioactive iodine that gets taken up by the gland, and it selectively targets those cancer cells. So it's kind of nice.
Minimizing impact on the rest of the body.
That's
then.
right. That's
Fabulous.
right.
All good tips to know about.
The advances are very exciting when you hear about stuff like that.
Yes.
Val Jones, thank you.
Thank you so much.